will get started. Welcome back to those familiar faces I see, and welcome to those of you joining in for the first time. My name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in Boston over the last 5 years. I own my own practice here, and I teach with the Community Online Academy every Thursday, all day. So lots of opportunities to take classes with me. Today we have a program that is stretch and strength for spine health using the foam roller. And we're going to be doing a lot of different movements today, some stretching, some strengthening, but I give a number of options to modify and progress the different movements that we do. So listen to your body, take the option that feels right for you, which may change from day to day, and that way you can get the most out of today's workout. I will save just a moment at the end of class to answer any questions that come up. So if you have a question during the program, you can always write it to me in the chat. I won't read those questions until after class, but I will certainly save a couple minutes to answer those questions. So with that being said, we're going to get started with the roller underneath our backs, and I'll show you guys that setup. So we'll be lying down on the mat. So I think the easiest way to find this setup is to place the roller underneath your knees and then lie down onto your back. And then the roller itself is going to go underneath your sacrum, and your sacrum is the bone between your tailbone and your low back. It's a nice broad flat bone. We're going to lift our hips on up, pull the roller underneath your sacrum, and then let your hips rest down. And it should feel comfortable. You can make little adjustments until you feel like it's in a good spot for your body. And then just kind of let your body relax and melt down. For some people, it may feel good to walk your feet a little wider than hips distance. You can even let your knees knock together in that position. So whatever feels comfy for your body to relax for a moment. Feel the length and tractioning of your spine by this having the slight inversion position. So by lifting the hips a little bit higher than our heart, we are creating decompression space through our low back. And while we have this decompressed position, let's tune our attention into our breath. Think of your lungs kind of like a balloon. We're going to have to work a little bit to send that breath down low into our belly, being in this declined position. So here, start to take a big, deep inhale breath in through the nose, feeling your belly lift and open with that inhale. And as you exhale, feel that air gently leaving the lungs, blowing out through your mouth as though you're blowing out through a straw. Try that once again. We take an inhale, big opening, expand and lift. And an exhale to gently let that go. We'll try one more time here, taking a big inhale breath in through the nose. And a gentle exhale breath out, sending all that air out of the deepest parts of your lungs. And we're going to start class today with a little hip opener, so a hip flexor stretch. So what that will look like, we're going to bring the right knee in towards our chest and gently hold that knee. So it doesn't need to be a pinch. It doesn't have to be the strongest pull. We're just gently holding that knee, and then you're going to walk your left leg out straight. Okay, so you're thinking of the front of your hip draping up and over the shape of the foam roller here. Now, right away, that should feel like a bit of a stretch across the front of your hip. If it does not, push your knee straight, draw your left leg to the midline of your body, and try and pull your right knee in a little bit closer towards your chest. And that should deepen the stretch you feel across the front of the hip. This, like I said, can be fairly intense, so I want it to feel like just a stretch, not pain and not intense pulling. Let your breath be in that comfortable, deep pattern here, taking the inhales in through the nose and an exhale out through the mouth. And that can help to recruit your diaphragm, which actually closely relates to how your hip flexor moves. And that hip flexor does attach to your low back. So tightness here can influence how your back moves. Now, this is an optional add-on. If you have sciatica, I would skip this add-on. If you do not, you can take your hands behind that right leg and stretch the right leg up to the ceiling. And just be gentle here. This is a stretch for the hamstring. You're gently pulling that right leg in, reaching your heel up towards the ceiling. Like I said, for sciatica, you're just going to keep that knee bent. And the reason being that this can be a little bit stressful to that sciatic nerve. We'll take one more big deep breath in here, and then we'll switch our legs by drawing the left knee in towards your chest first, and then extending that right leg out long. Once again, you may feel the stretch right away across the front of your right hip, but if you do not, push your leg a little bit straighter towards the floor. Walk your right leg towards the midline of your body, so bringing it to the left just slightly, and pulling that left knee a little bit closer in towards your belly. You can think of the space behind your rib cage as gently closing down as well. Sending your breath deep down into your belly with big inhales in through the nose and an exhale breath out through the mouth, blowing out as though you are blowing out birthday candles. Now again, option to add the extra hamstring stretch here through the left side by holding behind the left thigh and pressing the heel up towards the ceiling. We'll take one more big deep breath, softly pulling that leg in, keeping a soft bend in the knee or reaching it all the way straight if that's comfortable for your body. Hold and breathe for 3, 2, and 1. We'll bring both knees in towards the chest. And if you need to hold your roller to keep it from sliding, you can just gently allow your knees to rock side to side. This is a nice little massage of some of the glute muscles that fall up higher onto the pelvis, which are some of the ones that are involved with rotation of the hip. Good. Now, while I have you guys in this position, we're going to do a little core strengthening exercise that stretches those same muscles. So this time, softly lift both legs up to the ceiling. Notice how naturally your rib cage wants to lift. I want you to draw the ribs down as though you are imprinting your shoulder blades and rib cage into the mat behind you. Holding the roller with both hands, we start to scissor the legs and switch with straight legs. You can make your range of motion really tiny at the top or really big, almost reaching down towards the floor, but you're lowering down only as far as you can go, keeping your ribs down. If you lower your leg and your back starts to arch off the roller, you've gone a little bit too far. That means that your core is no longer doing its job of supporting your spine here. Good. 4 more. 3, 2, last time, bend both knees in, place your feet down. You're gonna lift your hips on up, press the roller from out underneath your hips. And we're gonna try one quick abdominal exercise here to practice coming up to a seated position. So take the arches of your feet and you're gonna walk that roller away from you until your legs are straight and kind of your heel, think like right on the pad of your heel, is resting on the top of the roller. Now, once you're in this position, I want you to push your feet down into the roller, okay? So almost like someone is trying to take that roller away from you. You are actively pushing down. I know you guys can't see that, but with that press down, we're gonna try and pull the roller towards us like so, but sit up at the same time. So you can practice a few times with the legs, pulling the roller in towards your bottom to bend the knees, and then pressing that roller back out. So find the sweet spot where you feel like you have a good grip with your legs. Now you have the option to just stay here. This is a nice little bit of hamstring work. If you would like to add your upper body, you're gonna look to your toes, curl up, and then press the legs back out, rolling back down. Exhale, curl up, pull the legs in, and press the legs down into the roller, melting your spine down. Arms reach long, exhale, curl, inhale at the top, exhale, roll back down, 3 more. Exhale, we roll up, pull that roller in, press the roller back out, lower down, last 2. Pretend like I can hear that breathing as you melt back down. Last time here. We roll up and we'll stay up. Nice job there, guys. Those are tricky. So we're gonna take that roller now behind our spine to roll out our upper back. So we'll start with the roller just below your shoulder blades. So I like to hold the roller here, find that position where it's just below my shoulder blades, walk both of my knees in so the feet are flat, and then hold my head in my hands. Bring your elbows into your peripheral vision. And we're gonna start to roll along the length of our spine, but only where our rib cage is. So I'm rolling right to the base of my neck, all the way down to just below the shoulder blades, but not into the lower back. We're focusing this here on the upper back. To protect your neck, make sure your head is really heavy in your hands and look down at your knees. You should just kind of be looking right over the top of your knees here, making sure that the rolling doesn't allow your head to drop way back. And as we roll back and forth, you might get some crunching or clicking, popping in your spine. That's okay, that is normal. As you're doing this rolling here, just know that that's helping to create some mobility in your spine. We are also getting a little massage of some of those muscles that surround our spine, all the way between our shoulder blades, down into our lats, which are down almost attaching to our lower back. Now, if you find a spot that is particularly tight here, go ahead and hold on that spot. Place your bottom down. Once again, just like our ribs were lifting before, I want you to draw the ribs down and then allow your spine to drape back over the shape of the roller behind you. Try taking a big inhale breath in through the nose and an exhale breath out through the mouth. Again, another big inhale in through the nose and an exhale breath out through the mouth. Now we'll roll once again and then maybe find a second spot where we can try the same thing. So allow your rib cage to come down, making the space between your ribs and hips smaller, but then dropping your sternum back over the shape of the roller. I like to imagine the front of my rib cage here like an accordion. It's being pulled down in one direction and open in the opposite direction, and that really allows a nice opening through the chest and our upper back. We'll take another deep breath in here, and then a deep breath out, lift up, and continue with your roll. Now I'm gonna sit up to show you guys a couple things you guys can continue to roll here. We're gonna add in side bending and rotation. Side bending is bringing one elbow towards the hip. Rotation is turning one elbow up towards the ceiling. So we're gonna do that while rolling to open up the differences you might feel from side to side. So while I'm rolling, we'll start on the right side, bringing your right elbow towards your right hip and continue to roll back and forth with that, which will help you to open your left side. And then you can do the opposite, which is to bring your left elbow towards your left hip, which will help you to open your right side. And see how that feels for your body here. You may need more attention on one side compared to the other. And if that's the case, go ahead and spend a little bit more time there. It's okay to be a bit asymmetrical in the work that you do with this foam rolling here. That's how you'll get the most out of this workout for your body. We can also add that rotation, so twisting one elbow up to the ceiling, one elbow down towards the floor. And that's gonna really get into some of the muscles on the side body, particularly the lats, which are, like I said, a shoulder muscle attaching all the way down to your low back. You can try the same thing on the other side, noticing where your body might need a little bit more attention. Maybe that's back into the center, and you can always come back to that point and try that same thing here. Good. We'll try just 3 more like this. That's it here, guys. Last 2. And 1 more time. Good. And then sit yourself on up. We're gonna get centered to do a little bit of abdominal work going into that extension. So this kind of looks like a crunch, but what'll be different here is that we are not actually going to crunch forward. We're gonna extend ourselves backward and then lift up just to the point where we are in our flat back. So what that looks like, we're gonna start with the roller once again underneath our shoulder blades. Knees are bent, feet are flat. We're gonna think of closing the space between the ribs and hips. So making this nice and small, holding the head heavy in the hands. From here, we're gonna let the spine drape over the shape of the roller. And as you exhale, push your ribs into the roller to lift just until you're in a long line. So we're not bending forward, we're just lifting to that long line. We reach back, extending over the roller. Exhale, gently lift. Inhale when you reach back, your breath will help you here. Exhale to lift. Keep your eyes on the top of the knees as you inhale, reach back. Exhale, lift up. If you feel like the roller is moving from underneath you, that means that you're not pressing enough with the back of the ribs. So you want to feel like you are pinning that roller to the floor by pressing the back rib cage into the roller. That's also what helps you to use your abdominals to do this lifting pattern here. 3 more. Exhale, we lift. Inhale, we drop back. Exhale, we lift up. Last 2. Exhale to lift. Get ready for a little hold. Last time we lower back. Exhale, lift up and hold. Now you have the option to just hold this. If you'd like a challenge, bring your legs to tabletop. Keeping the pressure on the back of the roller. Reach your right leg out and then your left leg out. You can go low as a challenge or high as a modification, only going as far as you can, keeping that pressure on the back of the roller. So if your ribs lift off, you've gone a little bit too far with your legs or too low perhaps. 4 more. 3, 2, last time, place both feet back down and take a gentle spine stretch over that roller, allowing the abdominals to stretch for a moment, taking a big inhale in through the nose and an exhale breath out through the mouth. We'll come on up to sitting. Nice work. So we're going to get into our hamstrings and glutes next to do a little bit of leg work. So we'll take that roller, go ahead and sit right on top of the roller. And we'll do our left side first so I can face you guys on the camera. We're going to turn very gently to the left, placing left hand onto the floor, right, and twisting your body gently to roll along the muscly part of your glutes. So you'll notice that there are a couple big bones in the area. One is right at the bottom of your pelvis, which is the ischial tuberosity. It's the bone that you would think of sitting on when we talk about sits bones. And then there is a big bone on the side. It's a part of your femur called the greater trochanter. And we want to be cautious with rolling over those big bony parts because they have small bursa in the area. A bursa is a fat pad that protects the bone and the tendon from rubbing against one another. And for that reason, they do not like friction. They do not like things like foam rolling. That's their goal, is to protect against those things. So we want to kind of roll on the muscle only and just be sensitive to those areas. Now, some people might be more tight in the central part of your glute by keeping your body pointed up towards the ceiling, whereas other people might be a little bit more tight, oriented more towards the side. So find what works for your body. Relax your shoulder away from your ear. And if you want to add more body weight, cross your right leg on top of your left. Now, if this feels like too much, go back to that double leg rolling. That's fine. Everybody's bodies need something a little bit different here. We'll try just another moment rolling like this, and then we're going to switch over to that right side. So my right hand is down. I'm going to turn my body to the right and continue with that rolling from the glute right up to the back of the pelvis, staying on the muscle. And maybe, orienting yourself more up to the ceiling or more to the side, depending where your body needs attention. And that might even be different than the left side we worked on. You can add more body weight here by crossing your left ankle on top of your right. And one thing to keep in mind is I get some questions from time to time about foam rolling for the IT band. The IT band itself is mostly ligamentous, and ligaments don't stretch. They are not designed to stretch. So foam rolling for the IT band itself is not tremendously effective. However, there are muscles that attach to that area, and that can be quite effective. These are some of the muscles. So one is called the TFL. It's all the way on the side of your hip. So if you wanted to spend some time and energy helping to manage IT band soreness, rolling your glutes is a great place to start. We'll try just another moment here. Excellent, guys. And then we'll take a little rest. We're going to press that roller back to underneath our thighs, and we'll roll out our hamstrings here. So we did a little stretch for the hamstrings earlier. Now we're going to get into some of the rolling along the muscles. And before we get rolling, I want you guys to think about the fact that our hamstrings are made up of 3 small muscles, and those fibers run from the outside of our thigh to the inside. Different people are going to be tight in different angles of those fibers. So I want you to explore a little bit in our rolling today, especially if you've done this with me before, the difference between some of the muscles more on the outside versus the inside of the back of your thigh. So hands come back behind you, and you're going to start to roll from your glutes down to just above the knee. We're not going to go over the knee joint. And if you have a history of sciatica, I want you to keep a soft bend in your knee. So about as much as I have here is fine. If you have a lot of wrist and shoulder sensitivity, a couple things. You can, one, separate your hands a little bit wider and turn them sideways. You can also lower onto your forearms. It's a little trickier here. I think you get a little bit less body weight. So if you can tolerate being up on your hands, do so. And you can always stop and take a little rest if that feels more reasonable for your body. Good. Take your shoulders out of your ears. Keep your head tall. It's also nice shoulder work. It's also a little bit of ab work here to hold your body up like that. Now, if you want to add more body weight, cross one leg on top of the other, and you can start to explore the outside versus the inside by gently twisting your body as you roll. And you might say, you know, okay, this left side feels pretty good, but now I'm going to check on that right side. And you may find, wow, this one is much tighter. Remember too that the hamstring is a fairly long muscle. It runs all the way to your hips. So make sure you're getting all the way up right to your glute and then down to just above the knee. And once again, you can roll in, you can roll out, find where your body needs a little bit more attention and be gentle, but take your time on that area. Good. We'll try just 3 more. And 2. One more time there. Excellent. Okay, so we're going to do a little bit of strengthening now for those muscles after we just did such a good warm up into the glutes and the hamstrings. By this time, placing the tops of our feet onto the roller and lying down on our back. So we'll find that comfortable position resting all the way down. And the arches of the feet are draping over the roller. You want to be able to tap your heels with your fingertips. Now we're going to do bridging here, but today we're going to do an articulated bridge, meaning instead of lifting our spine all at once, we are going to curl and roll the spine up and then softly melt the spine down as though we're picking up one singular vertebrae at a time. So arms press down into the floor, feet press down into the roller. I know you guys can't see that, but I am actively pushing my feet down as though I am compressing the roller underneath me. From there, we start to rock the pelvis back, curling to lift the spine up into your tall bridge, and then coming back down, letting the ribs come down, the mid-back, the low back, tailbone is the last thing to lower, back to our start position. We exhale, curl the space between your ribs and hips, lifting into your bridge and softening to melt back down one vertebrae at a time. Now, if you feel like you are going to get a cramp in your hamstrings, hug your knees together. You also have the option of taking your feet right off the roller. But I like to imagine in this articulated bridge that my spine is like a string of pearls, and I'm picking up one pearl at a time and then placing each individual pearl back down onto the mat at that same exact spot that it left off from. Press the feet firmly into the roller with your goal of trying to keep that roller totally still as you move your legs. And this is not easy. It takes a lot of focus and it takes a lot of strength to do this. But it also doubles as a nice stretch for your spine if you can really slow things down. 2 more. We roll on up to lift and softly, gently melting back down. Once more here, push down into the feet. We curl, rolling up and softening to melt back down all the way onto the mat. Nice job. You can stretch those legs out. If you would like to try a roll up here, you can reach your arms long overhead. Exhale to curl on up to a seated position. Otherwise, just come on up to sitting. And we're going to work now into the front of our thighs, our quad muscles. They also connect to our hip flexors. So that work we did early on in class will come back to help us here. We're going to take that roller in front front of your body. And this time we're gonna place the roller on our thighs, not on the knee joint, not on the hip, somewhere right in between. This also doubles as a nice abdominal challenge in a little bit of plank work. So we'll place the roller underneath our thighs, walking our hands out. You can have your knees down, you can have your toes down, you can also lift your toes. So whatever position feels comfortable, but make sure your shoulders are not sagging. We're actively pushing the shoulders into the floor, drawing the ribs up away from the floor. And then we're gonna just gently walk to roll the roller right up to our hip joint, and then right back down to our knees. Now you can keep your elbows fixed like so to press back and forth. You can also shuffle and walk your elbows kind of like an army crawl here. So whatever feels better for your body, keep the roller just along the length of the thighs, so not onto the knees. If you want to leave your feet down for a little bit more support here as well, that is an option. Try and keep your head lifted and shoulders down away from your ears. Now, just like we did for the hamstrings, if you want more body weight, you can cross one ankle on top of the other to bias one side of your spine. For me, these muscles are a little tight today. That feels too intense. I'm going to keep both legs down. Now the quad, similar to the hamstring, the quad is actually made up of 4 small muscles, and they run across the span of the front of your thigh. So same thing, that you can roll back and forth to the inside versus the outside by rotating just slightly here to get the differences in those small fibers of the quadricep muscle. Again, check in with your ribs. Notice if they're sagging. Try and lift your rib cage up as though it's giving your stomach a gentle hug as you glide your body weight forward and backward. Head is lifted. We're actively in that plank position, reaching the legs back behind you. We'll spend just another moment here. Good. And then press yourself back. We're going to finish with one more stretch to take a deep breath into the back side of our ribs. So for this stretch, a couple options. You can keep your hips sitting back over your heels. If that's too much for your knees, you're going to stack your hips on top of your knees. And then we'll just press the roller forward, allowing your chest to drop down. We'll inhale, lift up, and exhale, press the chest forward, drop down. If you're on your heels, you'll lift up and press back. 3 more. We lift, inhale, exhale, press out, head drops down. 2 more. Inhale, lift, exhale, press back down. Last time. We inhale, lift up. Good. Exhale, press out, hold. And then we'll walk our hands all the way up. Wonderful job there, guys. That concludes the movement-based part of our class. I know we have about 1 minute left, and there are a couple questions